Gender affirming, otherwise known as gender reassignment surgery, is a surgical procedure that alters a transgender person's physical and sexual characteristics, giving them a body that aligns with their gender. The surgeries may involve the face, chest, and genitalia. Many trans people experience gender dysphoria, a sense of unease because their biological sex and body don't align with their gender identity. This can cause depression and anxiety. Gender affirming surgeries can help alleviate gender dysphoria, which is why many trans people seek to have these procedures done. However, many people choose to not get these procedures because they're very expensive, they carry many risks, and they change fertility and sexual sensations. The first surgery I'm going to look at is facial reconstruction surgery. This procedure can be used to masculize or feminize the face. The procedures vary depending on the features you already have and the features you want to change. For facial masculization surgery, the surgeon might want to make these changes. To the cheeks, they might use implants to make them look more angular. For the chin, they might add bone, implants, or fat grafting to make it appear broader and give a sharper jaw. For the forehead, surgery can be used to create a wider forehead and to flatten the eyebrow ridge and lengthen the distance between your eyebrows and hairline. For the nose, cartilage bone grafting can be used to create a larger, broader nose. For the throat, cartilage bone grafting can be used to create an Adam's apple, and all these things are used to create more masculine features in place of the feminine ones. Risks with this procedure include bleeding, edema, hair loss at the incisions, implant migration, infections, and nerve damage. For facial feminization surgery, the surgeon can lower the hairline, so because men are more likely to have a receding hairline, they can make an incision along the hairline and bring the skin forward over the forehead to preserve the hair follicles. For the forehead, men tend to have a frontal bossing, so a more protruding bone on their eyebrows, so the surgeon can remove and reshape this bone to make it look smoother. For the cheeks, the surgeon can do cheek augmentation with implants or fat injections because women tend to have higher cheekbones and more fat. For the nose, the surgeon can remove and reshape the bone to reduce the width and create a more feminine tip. For the lips, the surgeon can raise the top lip by making an incision under the nostrils and add fillers to make them appear more big. For the chin, the surgeon can make an incision inside the mouth to then go and reduce the size and reshape the chin to make it look more pointed and oval. Same for the jaw. He can reduce the size and remove the sharp angles by shaving bone. And then for the Adam's apple, the surgeon can make an incision under the chin to shave the cartilage off the trachea. And then the risks would be the same as with facial masculization: bleeding, edema, hair loss at incisions, implant migrations, infections, and nerve damage. The next surgery I'll go into is top surgery, which is for people transitioning from female to male. So this surgery removes excess fat and skin from the breasts and repositions the nipples to create a flat chest and make your chest look more masculine. So I'll begin by talking about double incision top surgery, which is the most common type of top surgery. It begins by removing the nipple and areola and then decreasing the size of it as well as thinning it so that you can reattach it later, and you decrease it because men's nipples are smaller than women's. So then you make long incisions along the chest, then you remove all the excess fat inside of it, stitch it up, then you reattach the nipples and the areolas. So the benefits of this top surgery is that the nipple position looks more natural since you can choose where to place it, and there's a low risk of sagging. The next type of top surgery is peri-areolar top surgery, which is typically used for smaller breasts. So for this top surgery, you make a circle incision around the areola the size of a male nipple. Then you make a larger circle incision in the skin of the breast. Then this will create like a donut shape, and you're gonna remove remove all the skin from that donut area, leaving just the deep tissue. Then you're going to make a small incision in that deep tissue, and through that small incision, you remove all the breast tissue and excess fat. Then you use a special stitch to tighten the skin towards the areola, and then stitch it all together. You'll notice in the video that there's some pleating of the skin, so that should go away with healing, but sometimes it doesn't, which is one of the major downsides of this top surgery. The benefits, though, is that you can possibly maintain nipple sensation and that the scars are barely visible. The last top surgery is keyhole top surgery, which is used for people with very small chests, small areolas, and tight skin. So for this one, you make an incision along the bottom half of the areola, remove the breast tissue from there, and then close it right back up. The benefits of this one is that you can maybe preserve the nipple sensation, and there's very minimal scarring. The general risks for top surgery are infection, dog ears, which is a small piece of fat and skin that hangs out from the incision site, loss of nipple sensation, and scarring, which is a really big one for double incision top surgery. Okay, the next surgery is vaginoplasty, and this surgery is used to construct a vagina in the context of gender reassignment. So for this surgery, before getting the procedure done, you need to permanently remove the hair from your genitals. So then the surgery uses the skin and tissue of the penis and the scrotum. The tissue of the penis is separated to form a skin tube, and then a skin graft is taken from the scrotum and is attached to the end of the penile skin tube. Most of the urethra is then removed, and what remains of it is spread open. The corpus cavernosum, which forms most of the penis, is also removed. The corpus spongiosum and glands, as well as the neurovascular bundle, are left, and they act as a new clitoris. The skin tube is turned inside out and inserted into the space between the bladder, prostate, and rectum, and this serves as a new vaginal canal. A cut is then made to expose the clitoris and the urethra, as seen in the pics. The risks with this surgery include vaginal stenosis, which is when your vagina gets narrow and shorter, which causes pain during sexual intercourse, inadequate depth of vagina, vesicovaginal fistula, which is an abnormal connection between the vagina and the urinary tract, rectovaginal fistula, which is an abnormal connection between the vagina and the rectum. You can have nerve injury, and you can just have a poor cosmetic result. It's also important to note that with this surgery, you're likely to have to dilate it for a very long time, if not the rest of your life, which is when you have to use a device to stretch inside of the vagina to maintain its depth and caliber. The next surgery is phalloplasty, which is used to construct a penis in the context of gender reassignment, and this procedure is in multiple stages. So in stage 1, you might want to get a hysterectomy to remove your uterus, an oophorectomy to remove your ovaries, and then you'll need a skin graft from either your arm, leg, or side. I'm going to be talking about the radial forearm free flap skin graft because it's the most common, and that one takes skin, fat, nerves, arteries, and veins from your wrist halfway up your forearm. The phallus is then created from the radial forearm free flap. You can choose to have your urethra lengthened or choose to keep it how it is. However, if you choose to not lengthen it, you won't be able to pee standing up. You'll have to sit down to pee. So once the phallus is created, you can attach it, and then the urethra, the new one, is left detached from the existing one to allow the phallus to heal for a bit. And that's the end of stage 1. After the phallus heals a little, the clitoris is embedded beneath the skin at the base of the phallus, and then the new urethra is connected to the existing one. Then a new scrotum is formed from the labia majora, and then you have a vaginectomy to seal the vagina and remove it. And that's the end of stage 2. Now in stage 3, you can choose to put in testicular implants, so they're just silicone, and you can also choose to put in an erectile device. So normally the penis would stay flaccid, and then when you want to have sexual intercourse, you can pump the device and it'll get erect. So risks with this surgery include infection, partial phallic loss, which is when the neopenis doesn't have good blood flow, it can't survive, urethral stricture, which is when the release of urine is blocked by scar tissue, urinary fistula, which is an abnormal connection between a urinary tract and a nearby organ, and the erectile device can also be rejected by your body. I killed myself. I got all these